Hello, I'm Les Kertay, and I'm here to talk about work as a health behavior. The R3 Continuum mission statement says, we believe that everyone has the right to a productive, meaningful life. For me, that's not a platitude or something that I say because it sounds good. It's actually at the core of what I've come to believe on going on 20 years of working in the field of disability medicine. So in this talk, there are a few key ideas that I want to convey. First, that work, by which I mean being productive, is an extremely important part of what we do. Being at work is good for us, provides us with important resources, and it's an important way in which we make social connections. The opposite is also true. Being out of work is bad for us, physically, mentally, and financially, in ways that are more extreme than most people know. Second, work is so important that I think we need to think about it as a health behavior. I'll explain what I mean by that, but basically I'm saying that we need to think of being at work in the same way that we think of all the other things we do to take care of our health. And finally, that avoiding work acts just like an anxiety disorder. And if we approach it that way, we can help people have a better experience at work, help them stay at work when they need an accommodation, and we can help them go back to work faster when they have to be out because of an illness or injury. Everyone knows the old joke about the man who goes to see his doctor and says, "Doctor, it hurts when I go like this." And the doctor says, "I have the cure. Don't go like that." It's funny because it's obvious, because it makes us laugh at ourselves and our tendency to be self-defeating and our tendency to tilt at windmills and beat ourselves up trying to accomplish the impossible. John Grinder and Richard Bandler once wrote that human beings are the only species on the planet that will continue to do what doesn't work. Whether we're the only species to do so is open to debate. That we do it is pretty clear. The serious part of the story is that what we want is sometimes at odds with what we need and with what's good for us. This is particularly true when it comes to things that require effort or are stressful or don't feel all that good. Take health behaviors, for example. The Centers for Disease Control notes that 7 of the 10 leading causes of death in this country are attributable to chronic diseases, and that a substantial portion of those deaths could be prevented by modifying behavior rather than by medicine. Most of us know what those behaviors are. Don't smoke or use tobacco, don't drink alcohol to excess, exercise more, and eat better. 7 out of 10 preventable chronic diseases, diseases that cause premature death and lost years of productive life, could be prevented, cured, or at least made better by doing 4 simple things. Don't use tobacco, don't drink to excess, exercise more, and eat better. Not expensive medical treatment or high-tech cures or pills, but simple things that we can do without any investment in technological medicine. Among those chronic conditions are heart disease, cancer, stroke, and diabetes, none of which will probably surprise you, and which together accounted for 73% of deaths in the US in 2014. What might surprise you is that number 10 on the list is suicide. Suicide accounts for only 2.2% of US deaths, but that's still almost 43,000 people a year who take their lives. Together with the fact that the World Health Organization describes depression as the second leading cause of disability in the world, clearly mental health is a critical part of the public health picture. And it turns out that those same 4 behavior changes that positively impact chronic physical conditions are also effective in improving chronic mental health conditions, including depression and anxiety. So to that list of 4 major modifiable risk factors, we can add stress reduction, mindfulness, relaxation, disconnecting from electronics, taking regular breaks, getting enough sleep are all ways to reduce stress, and reducing stress reduces the impact of both chronic physical and mental health conditions. So what about work? Work is stressful. I've often asked audiences to indicate whether their work life is more stressful, less stressful, or about the same as it was 10, 15, or 20 years ago. Nearly universally, the answer is more stressful for virtually all time periods. Work stress comes from many sources. There's more information to deal with. We have constant change, the continuous need to learn new skills and new technologies, and the drive to get more done with fewer resources and fewer people. As technology has expanded the ability to work from anywhere, The boundaries of time, the 8 to 5 workday, and space, the 4 walls in the building in which we work, have become almost meaningless. Certainly, the workday is no longer limited to a particular set of hours, and many of us can work from almost anywhere with electricity and an internet connection. The good news about this is that we have more choices about where, when, and how we get work done. Bad news is that we are often expected by ourselves and by our employers to work more hours, and it's all too easy to get pulled into the urgencies of work in the evening, on the weekend, and even on vacation. We've traded one set of stressors created by work, time, and space for stressors of a different kind, more productivity, without changing the available resources. Even those of us who work in a specific location during specific times are often being asked to get more work done in the same amount of time in the name of efficiency. So, if work is stressful and stress reduction improves physical and mental health, we should work less, right? We should take more time off. We should avoid the stress of the workplace, right? In a word, no. Here's the problem. Work is good for our health, and being out of work is terrible for us. Working has multiple benefits. Work is a key means for obtaining the money we need to live. Work also meets important social needs. Most of our friends come from work. And for example, someone with a best friend at work is 70% less likely to leave that employer. We get our identity from work and derive status from it. Being out of work, by contrast, has terrible health consequences. People who are out of work are more likely to get sicker, are more likely to develop new comorbidities, are slower to recover, and they die sooner. Estimates depend on the methods and the length of time involved, but the studies I've reviewed indicate that there's anywhere from a 30% to an 80% chance that someone will die of any cause from being unemployed long term. Overall health is worse, mental health is worse, with an increase in rates of depression almost double for those unemployed for long periods. And medical spending is higher for the disabled population as measured by higher medical costs, total number of medical consultations, and hospital admission rates. Gordon Waddell, a world-renowned leader in understanding the benefits of work and the costs of being out of work, may have said it best when he said that if a new medicine had the same negative side effects of being out of work, we would consider it medical malpractice to prescribe it. And yet every year, thousands of people are taken out of work by their physicians and psychotherapists, often for no medical reason beyond the fact that work is stressful. The good news is that going back to work tends to reverse the negative effects of being out of work, even when we hate our jobs. That part's interesting. It's not whether we like our jobs that matter. What predicts the health benefits of returning to work is whether we find our work meaningful and that we are contributing. The bottom line is that work is good for us economically, physically, and mentally, just like not smoking, not drinking, eating better, and exercising. So I had this idea. What if we thought of work as a health behavior and treated it that way? It fits. Like exercise and eating well, being at work has positive health effects even though it causes some stress, and not doing it has negative effects. Like smoking and excessive alcohol, worklessness has negative health impacts, and reversing them improves health. Also, like other health behaviors, worklessness has known risk factors. Men, those who are older, those who do extremely demanding physical work without sufficient supports and safety mechanisms, and those at the lowest end of the economic spectrum are all more likely to be out of work. When it comes to predicting the duration of a disability, the severity of the illness or injury is in fact the #1 predictor of how long someone is out of work. But the other predictors are all psychosocial in nature. The individual's attitude towards work, the individual's physician's attitude towards work, the perception of workplace support for return to work, and the availability of compensation are all predictors of duration. Finally, the interventions to help people stay at work and return to work respond to the same kinds of interventions as other health behaviors. Things like cognitive behavioral therapy, motivational interviewing, and similar interventions are known to help with health behaviors, and they have been shown to be effective for helping with return to work. And now we come to the third idea in this talk, that being out of work for an extended period of time acts like an anxiety disorder and needs to be treated as such. We know that the longer someone stays out of work, the less likely it is that they will ever return. Once someone's out of work for 13 weeks, a quarter of a year, with a disability, their odds of ever returning to work anywhere go down to 50%. By half of a year, the odds are less than 25%, and they keep going down from there. But why? Certainly there's logical reasons for that statistic. People who are out of work tend to be older and sicker, and those with catastrophic injuries will tend to pull the average up. But as of 2011, the #1 reason for new claims in Social Security disability was back pain and other musculoskeletal problems, most of which have no known physical cause. Mental health conditions are the second most common reason, most of which are treatable and need not be disabling long term. Between them, those top two categories account for 53% of all new applications for Social Security disability benefits. The longer we stay out of work, the harder it is to go back, even when there's no strong physical reason that we need to be out of work. Instead, what seems to be driving staying out longer than necessary is worrying about whether we'll be able to do it. We worry about whether we'll be able to stand it. We worry about what other people will think. Like an anxiety disorder. So I had this other idea. What if we think of unnecessarily prolonged work absence as an anxiety disorder? And what if we treated it in a similar way? How would it make a difference to the way that we approach the idea of prolonged worklessness? All treatment for an anxiety disorder centers on two things: exposure and response prevention. Those are just fancy terms for saying that if something makes you anxious, you can't get over the anxiety unless you're around the thing that makes you anxious, and you need to develop a different response to it. Here's how it works. If you're afraid of driving over a bridge, you'll never get over it unless at some point you drive over a bridge. If you're afraid of flying, you'll never get over that without getting on a plane. It just can't happen. We also know that the longer you avoid the thing that makes you anxious, the harder it is to approach it. That's because avoidance becomes self-reinforcing. Staying away makes us feel better, and we tend to do what makes us feel better, and so we continue to avoid. But also, if you drive over the bridge, hyperventilate, and panic, that won't work either. Similarly, if you get on a plane and spend the whole time bent over in your chair screaming, nothing will change. You have to change the way you do things. It's the same with going back to work. First, like an anxiety disorder, the only way to treat worklessness is through exposure and response prevention. You can't get over the nervousness about returning to work without actually going back into the workplace, and you need new skills to make that happen. Sometimes we have to start slow, sometimes only a little at a time, or we might need an accommodation that makes it easier for us. But we have to do it, and we have to do it in a new way. So those are the ideas I wanted to share with you today. Work gives us meaning, provides resources, and it provides a social outlet. Work is also important for our mental and physical health. That's the first important point. The second point is that work is just like any other health behavior. It's associated with certain risk factors. It's a modifiable behavior, and it responds to the same kinds of treatment approaches. And finally, being out of work for a prolonged period of time leads to work avoidance, and work avoidance acts like an anxiety disorder. It also responds like an anxiety disorder. To overcome it, we have to be exposed to work, and we have to have a new way of doing things. So it turns out that the old joke isn't exactly right, because when it comes to work, even when it hurts, sometimes we have to go like that.